Bleeding gum is one of the common health problems. After seeing a commercial advertisement on TV or newspaper, so many people are using some medicine or toothpaste. Is it really effective? Bleeding gum is not a disease, but is a sign and symptoms of a disease that means it giving you an indication that you are getting some disease. For a proper treatment, you should know why there is bleeding gum. If you are not doing proper treatment, then you can lose your tooth. Only a dentist can diagnose, they can treat it, and you can save your tooth. If you are having gum bleeding, then it can be cured if a visit to the dentist at correct time. Causes of gum bleeding. 1. Bleeding due to dental problem, gum problems, gingivitis or periodontitis, ulcer in mouth or trauma. 2. Some general and other health problems can cause, aggravate bleeding gum, diabetics, HIV, poor nutrition, idiopathic thrombocytopenic purpura, hypertension, dengue, cardiac problem. Chemo or radiation treatment, medicine, may cause, like aspirin, some painkiller, oral contraceptives, antidepressants etc. can cause, aggravate gum bleeding. Gum problem or gingivitis and periodontitis, gum is the supporting and which surrounds the tooth. Gum disease, also known as gingivitis and periodontitis, is an infection of the gums that surround the teeth structure. It is also one of the main causes of bleeding gum and tooth loss among adults. There are two major stages of gum disease, gingivitis and periodontitis. Gum disease can increase space in between tooth, causes increased gap in between tooth. An early stage of gum disease causes swelling of gum, and later it can cause pigmentation or black spot on gum. If not treated, that it can cause bleeding gum and then a periodontal problem, loss of a tooth. Know the causes of gum disease. Gum disease can be caused by a number of factors, but poor oral hygiene is the most common cause. Mainly dental plaque and calculus causes gum problems. Your mouth is full of bacteria that combine with saliva to form a sticky film known as plaque, which builds up on your teeth. This plaque later becomes hard on the tooth, it's called calculus. When you take food or drink high in carbohydrates, sugary or starchy foods, bacteria in plaque turn carbohydrates into the energy they need, producing acid. This acid causes irritation of gums, making them inflamed, and gum disease. Risk factor for gum disease: who are prone to get bleeding gum, poor oral hygiene, tobacco, a family history of gum disease, malnutrition and vitamins deficiency, diabetes, age. Gum disease becomes more common in older people, weakened immune system, HIV and AIDS or certain malignancy. Chemotherapy and radiotherapy. Malocclusion and traumatic occlusion. Hormonal changes in girls, women. Sign and symptoms of gum disease. The symptoms include bad breath, red, swollen, bleeding gum, tender, sensitive teeth, painful chewing and lost teeth. At the early stage, the gum becomes red and swollen. If it's not treated, it causes bleeding gum and later tooth becomes weak, leads to tooth loss. Commonly, gum infection causes tenderness of a tooth, or later it can cause dull pain on the tooth or jaw. Prevention of bleeding gum: rinse water after every food, sometimes use chlorhexidine mouthwash. Stick to gentle, twice daily brushing with a soft bristle or electric brush. Use proper toothpaste. Use dental floss. Every 6-month visit dental clinic, get scaling treatment. Floss once daily and you can massage gum with your finger. Chewing habit of hard and fibrous food is a good habit, don't take always soft or liquid food. Avoid tobacco, betel nuts. Treatments of bleeding gum. Antiseptic mouthwashes containing chlorhexidine is given, or betadine gargle is recommended. Oral prophylaxis, scaling, for gum disease or root planning needed for periodontics. For gingivitis and periodontitis, scaling is the primary and important basic treatment to remove the causative factor plaque and calculus. If you have severe gum disease, you may need further treatment, such as periodontal surgery or periodontal therapy. Treatment plan is depending upon conditions. In some cases, it's necessary to remove the affected tooth. Commonly, antibiotics like metronidazole, doxycycline, amoxicillin is used upon the condition, painkiller used to reduce pain. Bleeding gum can be cured, don't neglect it, immediately visit the dentist. Visit our website www.medihelp365.com. You can find doctors, hospital, medical service provider information, you can read useful medical article and lots more. Subscribe our YouTube channel, Medical Help 365 Days, to see medical videos.